I am advocating people to start using this hashtag masks for all. I've used it quite a bit on Twitter, on the official Liberty Starship Twitter. And I have a lot of good information for you. Now, I'm going to start out a little negative because I am a little upset. There is some righteous anger out there, and I am going to address it because it has to be addressed. We have to have accountability. We have to have accountability. I think very possibly, as you know, and I'm sure you know, Pete, recently the CDC changed their tune, and we are in masks for all officially. That's official policy now. That is not, it is still voluntary, but the official CDC recommendation is masks for all. And so it's time to get educated on masks, people, okay? I have over 20 years of experience as a public safety professional, as a first responder on the front lines, responding to incidents in the field, dealing with people with airborne infectious diseases like tuberculosis, where we would have to mask those people. We were trained to mask those people, okay? So I know a little bit of what I'm talking about, all right? So, and I did a lot of research for you so that you guys can make some good, informed decisions. Now, I think one of the reasons that we finally got this turn was because of this Wired article. I'm convinced this Wired article, because Wired is a popular platform. This article is dated March 30th, okay? And this is the headline. It says, "It's time to face facts. America, masks work." It says, "Official advice has been confusing, but the science is hard to grok. Everyone should cover up." And we did say that in our last episode. We advised people, cover up, mask up. You heard it here first for a lot of you, okay?
And I've noticed people on Twitter adding masks work to their Twitter handle or to their Twitter name. Yeah.
Awesome. Awesome. So here's how they start out. When you look at photos of Americans during the 1918 influenza pandemic, one feature stands out above all else: masks. Fabric, usually white gauze, covers nearly every face. Across the country, public health experts recommend universal mask wearing, and some cities ordered residents to wear them under penalty of fine or imprisonment. We're talking about the Spanish flu, okay? The Red Cross made thousands of cloth masks and distributed them for free. Newspapers published instructions on sewing masks at home. Quote, "Make any kind of mask and use it immediately at all times," the Boston Commissioner of Health pleaded. "Even a handkerchief held in place over the face is better than nothing." This is 1918, folks. 1918. They advised this. This is what this was official policy for the United States of America. There's a great picture in this article. You've probably seen it. There it is. I love this picture. I love it. This is from Seattle at the height of the Spanish flu. This is Seattle PD, Seattle's finest. They are all masked up. Okay, 1918. Why have we lost? Why did we forget this lesson? Why do we forget this lesson? I'm going to get into it. But what's so great about this article is it actually cites the actual peer-reviewed scientific studies that tell us, yes, something is better than nothing, folks. The science was there all along. There is no new information. The Surgeon General lied. The head of the CDC lied. And I'm going to get into why I think they lied and what our path forward is now and how we can try to fix this and how they can try to fix this and maybe save a little face and maybe try to kind of reverse this policy that I think has cost people their lives, because we have a large number of deaths in the United States already, and not masking up was a huge mistake. And it was something that we did because our medical professionals, our medical community told us not to. So we have some different studies that were done. They're cited in this article. And the main takeaway from these scientific studies is that, first of all, masks work. The surgical masks, the actual surgical masks, surgical grade masks, and N95 masks are basically about the same. We've heard all sorts of lies that surgical masks are not as good as N95 masks. They are. Science says they are, okay? Now, when it comes to homemade masks, Let's see if I can find the paragraph here. Because they cite several studies where they compared homemade masks. So meanwhile, several studies have tested the performance of masks improvised from household materials. A 2008 paper, Pete, 2008 paper, found that masks made from kitchen towels were about half as protective as surgical masks. And part of this article talks about how surgical masks are the same as N95 masks. We're talking about influenza. We're talking about aerosolized infections. Just as effective, okay? For a study published in 2013, scientists compared the filtration efficiency of surgical masks to linen, silk, a scarf, a kitchen towel, a pillowcase, a vacuum cleaner bag, and masks that volunteers made 100% cotton t-shirts. The surgical mask performed best, followed by the vacuum cleaner bag and kitchen towel, but the latter was too thick and stiff to be worn for long periods of time. Consider this, folks. If you're not going to wear it because it's impeding your breathing or it's too uncomfortable, that's not a good mask choice for you. You need to do a mask choice that you are going to actually wear and use. The t-shirt masks were comfortable and 1/3 as effective as the surgical masks. So not as good as surgical. And by the way, surgical as good as N95 according to these other studies, but they were still better than nothing. You know, better than nothing, which we were told by so many medical professionals, no, something is not better than nothing. No, you're too stupid to wear a mask. Says our findings suggest that a homemade mask should be considered as a last resort, the authors wrote, but quote, it would be better than no protection. A 2010 study reached nearly identical conclusion.
We were told, sorry, I just to jump in here a little bit. We were told by a lot of health officials that these masks could actually be more dangerous because they carry germs and they wouldn't be cleaned properly, that they would be more likely to carry the virus than protect you from the virus. Do you remember hearing that?
Pete, that's a good segue into what I wanted to talk about next. That's an excellent segue. So I wanted to talk about why did they lie to us? Why did they lie to us? There's some righteous anger here, and I feel that righteous anger right now. And I think it's three main points. First of all, the Surgeon General has alluded to this in his tweets. He's kind of admitted to what he did, okay? We have the supply hoarding issue. We had hoarding happen very early, even before people were starting to take this seriously. Probably people that I knew in the prepper community started hoarding the damn masks, which is the worst thing they could have done. It is the worst thing they could have done. The masks are most effective if everyone wears them, not you. It is a community effort. We all have to wear them for them to be most effective because they're most effective with people that are infected but not sick. That's news. There are many more people infected than what the tests tell us, and the CDC is now saying as many as 50% of those infected never get sick. Think about that. And they are spreading this infection all over the place. So when you see these numbers, you see those laughable Chinese numbers. These numbers are like 10, 20 times the numbers of the tests. Okay, that's what we're being told right now. Okay, so it's so essential that everybody wear a mask. So legitimately, there's a supply problem. We had people go and hoard masks, N95 masks. We had them hoard surgical masks, and we haven't been able to find them for months. I haven't been able to find one for months. Okay. Luckily for me, I have a small supply on my own, okay, that I bought in my prepper days. So I actually have a small supply of expired N95 masks, which again, are better than nothing. Folks, they're better than nothing. So we have the supply hoarding issue, which was legitimate, and they should have explained this to us, but they don't trust us with that information. That's the first point. It's a legitimate concern. But I would say one thing that I'm upset about is first responders, fire and police, and ambulance drivers, EMS, should have gotten the same priority as the rest of our healthcare professionals, and they didn't. That image I showed you is from 1918. I bet you the 2020 Seattle Police Department is not doing universal masks. So, because nobody is, they don't have enough. And they were told before the cotton masks didn't work. And I just told you the cotton masks work. The cotton masks do work. They do reduce the transmission of the infection. These are old studies, folks. These are old studies. That's the righteous anger. The second thing is cultural bias. As I mentioned before, in 1918, we were better, and we all started wearing masks, okay? It was universal. It was required in many communities in 1918. That's also happened in Japan. But in Japan, the culture never got rid of that mindset. And we know the numbers are much lower in Japan, and I am putting forth the theory that the reason numbers are low in Japan is because of universal mask wearing. That's what's keeping the numbers under control in Japan, because Japan is not doing very much. They're not doing hardly anything, but they all wear masks, and they also are socially distant to begin with. The culture is socially distant, okay? They don't like to handshake. You know, they bow, you know what I mean? Those kind of things are helping them, in my opinion. And the science tells me that that's true, because the science says that if we all wear masks, we will reduce transmission of this disease. That's the science, folks. This article cites the studies. And I will share this article in the description of the YouTube version of the show so you can look for yourself. All of the studies are cited in this article. It is an excellent article. And this reporter did excellent reporting. I wish there were more reporters like him for breaking this story.
Right. And if you say that these masks are only half as effective as the other masks, we should remember that, you know, the growth may be geometric. We're seeing geometric growth, but if you slow the growth, that has geometric benefits too. So I just did the math here. If the growth of the virus is 15% every day, after 10 days, you have 4 times as many cases as when you started. But if you double that rate to 1.3, 30% growth every day, then you have 13, almost 14 times as many cases at the end of 10 days. So this is literally killing people right now, lying to people, because you again, they're trying to sort of engineer people a little bit, nudge them in the way that they thought, but they couldn't contain it because the truth is out there. These studies aren't secret studies. This isn't secret information. And once the cat is out of the bag, then all trust is lost.
Peter, this article, you can see they have like the little underline. This is a very well cited article. You can go directly to the scientific studies that were peer reviewed. These are peer reviewed public studies that were done in 2008. Okay, 2008. If you recall, our last pandemic was actually in 2009 with H1N1, and I lived through that. I got the flu and pneumonia at the same time during H1N1, where we did almost nothing. We did almost absolutely nothing. My infant daughter had H1N1. Right. That was very, very scary. Very, very scary. So we thought she might die, okay? Because it was killing babies. So here's the third part, Pete. Here's the third part of why did they do this. And this also is legit. This is where you come in. This is where I come in. This is what I really want to leave with people. Improper use of masks. You must know some basics about how you wear a mask, donning and doffing, putting it on, taking it off. If you're going to make homemade masks, you need to have some controls. You need to have some procedures. And I'm going to try to discuss a little bit about that. The biggest thing I see, ever since the CDC changed the guidelines, I'm seeing more people with masks. So that's good. A lot of them even have surgical masks and N95 masks. They seem to be more prevalent than I thought they were, at least in my neighborhood, okay? I'm seeing quite a bit of them. I am not seeing a lot of the improvised masks, and we need to see the people that don't have the N95 mask and the surgical mask, we need to see them mask up. But here's something about those of you that are lucky enough to have an N95 or a surgical mask, because they're the most effective. Here's something that I see all of you people in my community doing wrong. Stop touching the damn mask and stop touching your face. And that is what the doctors, the people that knew this information, they think you're too stupid to do that. And you're showing them you are. I literally saw someone in my grocery store with an N95 mask, and he had pulled it down under his nose. That means he's constantly adjusting the damn thing, you know, but depending, I guess, on contact. Who knows what his procedure is? You know what I mean? Don't touch the damn mask once you put it on. Do not touch it unless, at a minimum, you have used hand sanitizer. You should be washing your hands first and then don the mask.
Well, the other now you're making my face itch.
Right. Well, then with the surgical mask, remember One thing that's nice about the surgical mask, first of all, they're more comfortable. I wore an N95 mask on my shopping trip. You can get winded with those things very easily. Again, the N95 mask is not any use to you if you're not going to wear it properly. That is true, okay? You're much better off with a more comfortable mask, and that's why I'm giving you options here. The surgical masks are more comfortable, and they use loops around your ears. That's usually how you can kind of tell the difference between the N95 and the surgical. The N95, they have like straps. The surgical masks have loops. Okay, if nothing else, you can look for that. Well, the loops, that's how you want to don and doff the surgical mask. You want to touch the loops and touch the part by your mouth as little as possible. And you never want to touch them without clean hands. At the very least, hand sanitizer, I would advise you to wash your hands. This whole system is going to be more effective if you use the trifecta. Wash your hands first before you handle your mask. Mm-hmm. Wash your hands first, don the mask, and keep your social distance. If you do those three things, you are less likely to acquire COVID-19, but you are even much less likely, if you have COVID-19 and don't know it, to pass it on to anybody. So do those three things, okay? It's very important. And like I said, if you cannot keep that N95 mask that you hoarded on your face and you keep adjusting it, you've completely lost the point. So
wash your hands, put it on, don't touch it.
Don't touch it. Don't touch it. And again, this is why it's important to look at these variety of masks. And so I am going to dramatically show my face for the first time on this. I have been wearing the most simple mask that is scientifically proven to reduce infection. I am wearing a shirt over my face, okay? This is a 100% cotton t-shirt. Now, the really nice thing about it is if the elastic is still good, it gives you that little seal over your nose. And I have been wearing this the entire time that I've been broadcasting. I've been talking. It does get hot, but it is very comfortable. It is much more comfortable than my N95 mask. It's much more comfortable. If you do nothing, this is what I want to leave people with. If you do nothing, do this. This is very easy. You get a nice little seal, the pinch, like with some of the homemade masks, you're advocating tin foil, paper clips, because you want to get that little pinch. It's important to get that little pinch on your nose. And if the elastic is decent in your shirt, you get it. The other thing that's nice about this is the CDC is advocating shirt masks, and they're telling you how to cut them. Stupid. You don't have to cut it. And you're losing the elastic if you do it the way the CDC is telling you to. They don't use the elastic, okay? They tell you to cut the bottom of it and make little straps. It's stupid, okay? I didn't do anything to this shirt. I didn't do anything to it. I just put it on over my head. I have the elastic. It gives me the nice little seal on my nose. And then all I did was took the sleeves and tied it around. And then I can tuck in the excess and look. I've actually got more coverage than a surgical mask right now or an N95 mask in terms of more of my face is covered. And that's going to help me with all this stupid thing that people are doing. Don't do this. Don't do that. Okay? But if you're one of those people that has to touch it all the time, at least now your face is covered more. You know what I mean? There's less chance of you infecting yourself, others, all that kind of stuff. If you do nothing else, just do this. You do not have to cut it. You don't have to do anything with it. I will have a link from the person that showed me this. I will put his YouTube link and he also does a bandana mask, and he also does a paper towel mask. And the thing that's nice about paper towel masks is if in the future you get your hands on filters, you can incorporate a filter into the paper towel mask, and you can also incorporate a filter in the bandana masks, okay? So, but please, folks, I showed you the science. It's there. This is the bare minimum. You don't even need scissors. All you need is a decent 100% cotton shirt. And I'm telling you, don't do it the CDC way because it's stupid. Cutting and all this stuff and trying to get the straps. I don't know what they're doing. This is all you got to do. This is all you got to do. And look, it's tucked under my my collar. Good to go, folks. Good to go. And the studies showed with normal people in the study, this was the most comfortable option. In other words, the mask doesn't work if you don't wear it. If you're constantly playing with it and taking it off, and try the other options. You can Google it. Try the vacuum cleaner mask, which is the most effective homemade mask. If you think you can do it, if you can sew, especially, think about doing the vacuum cleaner mask. Because vacuum cleaner bags are still out there. People haven't figured out that trick yet. Okay, so
not much longer.
The CDC is also advocating coffee filter masks and shows you how to make that. And I thought that one was pretty good. But what I don't like about the CDC's t-shirt mask is they make you cut it. And they make you have little straps. They basically make you cut it like a little surgical mask. And it's not necessary. And people are lazy. They're not going to do it. You know what I mean? So do the most simple thing, at least, folks. And I will try to get information about how to clean, like if you're N95 or your surgical mask. I'm working on stuff like that. There is a Stanford study that does say that you can sterilize your N95 mask with your oven. There's all sorts of good stuff out there, folks. And Pete, where's your mask? Where's your mask, huh?
Well, thankfully, I'm not going to infect anybody through the internet, as far as I know.
Set the example. That's the other thing.
I should set the example. You're right. Okay, next week we'll do.
Set the tone. I challenge every politician. I challenge Governor Ducey. I challenge the Surgeon General, and I challenged him on Twitter. He's not going to acknowledge me. But maybe if enough of us do, maybe the Surgeon General will start wearing a mask. Maybe Donald Trump will start wearing a mask because he has that cultural bias too. That bias is going to kill people. I don't like masks.
I've noticed a lot of older people, they're afraid of looking silly, and that's sad. It's dangerous because they're the most at risk. And Donald Trump, who is a germaphobe, he is really afraid of shaking hands.
That's true.
He doesn't like when people cough around him. Do you remember how he freaked out when Mick Mulvaney was coughing around him? He doesn't like it, but he still won't wear a mask because he's afraid it makes him look like a dork.
Right. And I think I look pretty badass, honestly. Yeah. I think, by the way, you can do this another way where you're full ninja. There's another way to do the fold and full ninja. Come on. Who doesn't want to be a ninja?
Sure.
Right?
Yeah. But I've heard that from just so many people, and it's just time to get over it.
So mask for all, please start using it. I didn't come up with that. That's something that I found out there in the wild. So that's just my message for everybody. This is really easy. And again, the CDC one is just, it's good that there's no sewing, but people aren't going to do that. They're not going to cut it and everything like that. You know what I mean? Make it as simple as possible. Make it as simple as possible.